trying times, every penny, every dollar counts. Residents in hard and difficult economic times. So we're proud to have this partnership with Coast to Coast, and very excited about it. And again, welcome over here at this time. I'd like to ask Councilman Crowder to say a few words.
Thank you so much. It's wonderful to be able to have such an instrument to be able by citizens that are underinsured and not insured to have access to discounts on their drug card. Obviously, those people who have insurance that some drugs are covered, those of us who are senior citizens, even though I do not claim to be a senior citizen yet, that's a joke, we have an advantage of having Part B coverage. And so this particular tool that is now available to all the citizens of Anderson County that are underinsured and uninsured can now have some of the same benefits with cost reductions up to 75%. So that's a great plus, and I appreciate Mr. Burns and the representatives of the card company allowing Anderson County to lead the way in having this tool by citizens to take part of, especially in this economic environment in which we are in. So thank you a lot.
I appreciate everybody being here today. Just to echo a little bit about what the two council members said, this is something that is available to every citizen in the Anderson County. It doesn't cost anything. You can use this all over the state. There's been a campaign that I'm going to let Roger tell you about to introduce this to all the drugstores, and it's called the Coast to Coast Prescription Drug Card. And we think it's going to be a benefit for everybody in the county. Again, hitting on what Mr. Crowder said, especially the uninsured and underinsured. We think it will help a lot in that area, but it'll also help everybody. Is it going to help every last time? No. But you should always present that card, and there's a chance you can save. The other thing is you can actually save money for your pet prescriptions with this also. So we think that's a neat wrinkle. But I'm going to let Roger, who is our representative, come in here and tell you all the facts, figures, and everything you need to know.
Thank you, Rusty. We'll be careful. The Coast to Coast is very honored to have Anderson County as the first South Carolina county on board with us. We've been marketing this program now for about 4.5 years. We have over 150 counties and over 100 cities and townships nationwide on board with us. Yesterday we were endorsed by the state of New Mexico, which makes the 7th state association that's come on board with us. This discount card not only is good for prescription discounts, it's also good for discounts on dental, vision, hearing, lab, imaging, x-rays, CAT scans, hearing, diabetic supplies and equipment, veterinary services, and veterinary medicines. The card so far this year has averaged on prescriptions a discount of right at 60%. And it has provided cardholders with discounts 80% of the time when it has been presented along with a prescription. As Rusty mentioned, it's primarily for the underinsured and uninsured, but it also helps those who are insured when they have high deductibles, high copays, have a pre-existing condition, or their current plan has a limited formulary. Plus, also this will give you discounts on your lifestyle medications such as Viagra, Cialis, medications for baldness and other things that typically are not covered under your health insurance plans. Does anyone have any questions?
You might want to mention that every time that card is used, what happens for Anderson County?
Yes. Every time the prescription card is used to fill a prescription, Coast to Coast will pay Anderson County a royalty of $1.25 per prescription. That royalty does not affect the cost of the prescription in any way whatsoever to the cardholder. To give you an example, Augusta, Richmond County, Georgia, which has been on board with us now for a little over 2 years, their county population is only about 20,000, I believe, more than Anderson County. Currently, Augusta, Richmond County residents are filling between 1,200 and 1,400 prescriptions each month and saving between $40,000 and $50,000 each month.